When a patient comes in, they are trusting us to deliver the best care possible. They want outcomes. It's all about outcomes. It's not about consumer surveys and preference reports. It's about outcomes. This is a facility that has prided itself as having the highest quality in the region and doing it in less than outstanding facilities. We were working in a 1927 environment. We can no longer install some of the newer technologies that provide for an enhanced environment. So we were working with one hand tied behind our back and doing an outstanding job. We wanted to untie that other hand and allow us to provide world-class care. We now have what I think is a world-class facility.
Before the previous surgical environment could be improved upon, an intricate plan was required. The vision, straightforward. Create a state-of-the-art facility with cutting-edge technology, increasing operating room efficiencies, and ultimately improving our patients' journeys. The implementation, intense. We visited the most innovative surgical centers in the world, adopted their best practices, and created our own. We then developed a blueprint for the all-new surgical pavilion. The outcome? Magnificent. 50,000 square feet of architectural and operational perfection. With a focus on patient safety and efficient workflow, we've made sure the new pavilion does more than just look good. We've made it a center for surgical excellence.
This is a lot more than just developing a beautiful edifice. This is about developing a structure that supports an initiative that is there to help improve the quality of the care that we give to our patients, to improve the experience of the patients, the experience of the patients' families, and the efficiency that we can provide care for the patients, their families, and for our physicians. The most amazing thing to me is not how beautiful it looks, it's the amount of thought that was given to absolutely everything that goes behind the walls that people can't see. Behind each of those walls there are miles and miles of medical gas tubing, fiber optic lines, electrical lines, venting ducts, all the supplies that make this operating room the safest potential environment for anybody to get surgery any place in the United States.
I think we really spent a lot of time over the last 3 years in the whole design phase and actually the build and implementation of really thinking out of the box. We really wanted to build these operating rooms for the future. Looking at our process improvements and bringing in lean methodology and techniques that we really have been able to analyze all of our processes and eliminate redundant steps and really improve all that we deliver to both the surgeons and to our associates and our patients.
An easy way to define lean, it's really a philosophy that's about honoring the associate that has to do the work every single day. So instead of a group of directors and managers sitting around figuring out how to problem solve, you bring the folks to the table that actually do the work every day, and you let them design what the best process ought to be, and you implement a continuous improvement model so that that change occurs on a daily basis.
We created a safer operating environment with improved ergonomic conditions for our surgical team, giving them unmatched mobility and minimal clutter. Ceiling-mounted surgical booms allow for a cleaner design and keep tools organized and elevated to enhance workflow. In-room cameras and plasma screens enable our staff to monitor progress and coordinate patient care. And standardized layouts are designed to allow us to handle any case with nurse, anesthesia, and surgeon areas that meet their workflow needs.
The new surgical pavilion allows me to practice the art and the craft and the science of surgery in a new, spacious, technologically state-of-the-art facility. The ease with which we can utilize all the equipment without stumbling over it is fantastic, but the patient flow in and out of the rooms has become a real major plus. People will be able to just feel much more relaxed and at home and comfortable because the spacing is bigger, and all the new bells and whistles that we have there will just make it superior to any other facility around because we are the newest and the state-of-the-art.
This will be a significant boost, not only in the morale of our overall operating team, it'll be a huge step into the future as far as our technological advances and our abilities to offer those types of surgeries and procedures to our patients.
From the state-of-the-art surgical suites with cutting-edge technology integration to improved patient care flow and safer operating environment, the new Surgical Pavilion has been years in the making and stands as a shining example of a coordinated effort of all parties. The result? A higher definition of surgical excellence. Welcome to the Surgical Pavilion at St. Joseph Mercy, Oakland. Advanced technology, expert care teams, outstanding outcomes. St. Joseph Mercy, Oakland, a member of St. Joseph Mercy Health System. Remarkable medicine, remarkable care.